Hi, my name is Jurewicz. I'm with EMH Physical Therapy, and today I'm going to show you a technique called the muscle energy technique. So here at EMH Physical Therapy, we see a lot of patients with pelvic floor dysfunction. A lot of times patients will come in to me with a pelvic malalignment. Most often I see that they have a right anterior non-alignment. So what that means is that the pelvis is tipped forward on the right. So how this relates to the pelvic floor is that if the pelvis isn't aligned, then you're not going to have proper support through the pelvic floor. So what we do is we use the muscles back here, the gluteus maximus muscle, to pull the pelvis back on the right side into that proper position. So again, patients will come in to me with their pelvis rotated forward. They could come in with it rotated forward on the left or the right, and I use the gluteus maximus muscles back here to pull the pelvis back into its proper position. So let's say my patient had a left anterior non-alignment, meaning that the pelvis is forward on the left side. I'm going to activate her left gluteus maximus to bring the pelvis back into the correct position. So I'm going to flex her knee and her hip up to about 90 degrees. I'm going to place my hand in the back of her thigh behind her knee. And I'm going to ask my patient to keep her legs steady as I apply a force towards her head. So don't let me move you. And I'm not applying a significant force. I want to feel the muscles start to contract, and then I just maintain that pressure. So I want to hold for about 6 to 10 seconds, and then I'll have the patient relax. Go ahead and relax for me. And then I'll move her leg down and provide the same pressure. Don't let me move you. And relax. And I'll come down even further. Don't let me move you. And relax. Then I can have the patient follow up at home with the technique herself, where she places her hands behind her own thigh and tries to kick her leg away from her hands. Good. And then we reassess her alignment, and most of the time I find that patients are now in a better position after the technique.